All right. So, what is the most common site of compartment syndrome? This is a factoid based question. You're going to know it or you're not going to know it, but there are some things that we could think about to help narrow down the answer choices. So, the answer choices are A, anterior compartment of the lower leg, B, anterior compartment of the thigh, C, lateral compartment of the lower leg, and D, volar compartment of the forearm. Well, let's start with answer choice D. And the volar compartment of the forearm, that certainly is a known or common location for compartment syndrome. It is most commonly associated with supracondylar fractures in children and radial head fractures in adults. However, it is uncommon overall. And while it is possible, it is certainly not the most common. So we're going to cross that out. And then we're left with two answer choices that include the lower leg and one answer choice that includes the thigh. Now, let's just think about compartment syndrome and what it is. Okay, so ultimately, right, you have some type of, usually it's a trauma, potentially could be an infectious process as well, or post surgical, let's say, but you have increased pressure within a non expandable compartment. And then that results in compromised venous blood flow. That results in worsening congestion and subsequently arterial compromise. And this leads to ischemic necrosis of the muscles and the nerves within the compartment. So, what you're really thinking about here is if it's going to be the most common, it's probably not going to be a large compartment. Okay. So, I think about the thigh. The thigh is pretty large. The femur runs through it, but there seems to be a lot of area for expansion or edema. So I'm going to cross off anterior compartment of the thigh, answer choice B. That leads us with anterior compartment of the lower leg or lateral compartment of the lower leg. And if you think about the anatomy of the lower leg, you have the tibia, which, right, if you feel your lower leg, you're essentially, right, you feel that tibia. It's more difficult to feel the femur because you have so much muscle on top of it. In the tibia, it's pretty superficial. And so that's a very small compartment, very tight compartment of the lower leg here. And so the lateral compartment, you could feel on your leg, there's a little more soft tissue there, and the fibula is not as prominent. So of these two answer choices, I'm going to cross out lateral compartment of the lower leg and stick with the anterior compartment of the lower leg. And I know that tibial fractures are at highest risk for developing compartment syndrome. So let's go with answer choice A. And sure enough, that is correct. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to RoshReview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.